So I think we're at a great number. So let me introduce myself again. I'm Dr. Margaret Larkins Pettigrew. I'm going to be the moderator for this evening. I want to say again to everyone who's joined us this evening and decided to spend some time with us, good evening and welcome to the University Hospitals and the Legal Aid Society of Cleveland's Town Hall. And the Town Hall was on how COVID-19 will affect your holidays. So I've got a few housekeeping items I want to just tell you before we get started. In this platform, the attendees are not visible to anyone and their mics are muted. While you won't be able to ask questions through audio, please note the Q&A function on your screen. If you have a question for our panelists, feel welcome to type your question and press enter to submit it. Questions that are submitted will only be visible to the moderator and the panelists. Members of the audience will not be able to see submitted questions, so don't be shy. Enter the questions that you may have. Also, today's webinar is being recorded and will be posted on our website. As a registrant of today's session, you will receive an email with the link to the video after the program. Lastly, a legal disclaimer. Now, this webinar is intended for informational and educational purposes only. The information provided should not be used as a replacement for medical or legal advice. So although this content was reviewed and approved by healthcare professionals and our legal team, UH does not guarantee the accuracy or completeness of any of this information or that it represents the most up-to-date information. So UH is not responsible for any errors or omissions or actions taken in reliance or from use of such information. So let's get started. A little background. The COVID-19 pandemic has affected every facet of our day-to-day lives. The number of individuals infected by the virus has steadily increased as we head into the holiday season. The disproportionate impact of COVID-19 on the African American community clearly shows that most work needs to be done to protect and secure this community from the devastating effects of the pandemic. We are hosting this town hall event as one of the steps to achieve this goal. Our organizations have brought together a fantastic panel of healthcare and legal professionals to give the community an opportunity to ask questions and to inform the healthcare and legal community about the issues and struggles that they are dealing with during this pandemic. So this is bi-directional. We want to help you, but we want you to help us as well. Identify what we need to do and help you better. So with your participation, we hope to discover new health and legal issues that we have not seen and find out if the services that our organizations are currently providing are assisting the Northeast Ohio and African American community. So without further ado, let me introduce this phenomenal panel that we have tonight. First up is Dr. Keith Armitage. My dear friend is an infectious disease specialist and serves as medical director of University Hospital's Roe Green Center for Travel Medicine and Global Health. He's a professor in the Division of Infectious Diseases at Case Western Reserve University School of Medicine, and he is the vice chair for education at University Hospital's Cleveland Medical Center. Dr. Armitage's primary professional focus has been on postgraduate medical education and clinical infectious diseases. Dr. Armitage is he is a master of the American College of Physicians and has been recognized among Americans' best doctors by U.S. News and World Report and as a top doctor by Cleveland Magazine. Dr. Armitage received his undergraduate degree from the University of Kansas and attended medical school at the University of Colorado. He completed internship and residency training in internal medicine and infectious disease fellowships at Case Western Reserve University and University Hospital's Cleveland Medical Center. And he stayed in Cleveland because he loves the weather. So welcome, Dr. Armitage. Next on our panel, Anastasia Elder Esquire. She's a staff attorney at the Legal Aid Society in Cleveland, where she serves on the Right to Counsel team in the Housing Practice Group. So important in this time. Prior to working at Legal Aid, Ms. Elder held various legal roles within local government in the areas of compliance, advocacy, and the court. So she's been a busy, busy lady. Ms. Elder is a member of Legal Aid's African American Committee, which is dedicated to working on education, outreach, and advocacy related to the African American community in Cleveland and Northeast Ohio. So big, big territory. Ms. Elder is passionate about service and truly believes it is her work that is the rent that you pay to live on earth. She currently volunteers as a mentor for the Cleveland Marshall Law Alumni Association first year mentoring program and College Now Greater Cleveland. She's also a volunteer with the Cleveland Metropolitan Bar Association's 3 R's program, and hopefully she'll share some of that with us. And then we have, of course, Dr. Carla Harwell, a trusted colleague of mine, who serves as the medical director of University Hospital's Otis Moss Jr. Health and Community Center in the Fairfax district. She's been there for many, many years. She's also an associate professor of medicine in the Division of General Internal Medicine at Case Western Reserve University School of Medicine and on the full-time faculty at University Hospitals at Cleveland Medical Center. Dr. Harwell's clinical focus is outpatient general medicine and primary care with an additional focus in healthcare disparities. She's where she is because this is her primary focus, and she's done phenomenally over in that area. Dr. Harwell is nationally recognized as a leader in education on healthcare disparities and medical issues affecting minorities. She has received numerous awards, including national ranking as top doc by the U.S. News and World Report for the last 10 years in a row. Dr. Harwell attended medical school at the University of Cincinnati School of Medicine, completed her internship and residency training at University Hospitals Cleveland Medical Center, and she has remained with us for all of these years. The last but not least panelist is Corinne Huntley. She's a staff attorney at the Legal Aid Society of Cleveland, working in their organization's economic justice practice group. She has dedicated her legal career to employment law. Ms. Huntley has been instrumental in the development of Legal Aid's employment discrimination practice. She is a co-author of 2 recent op-eds, one in Crain's Cleveland entitled The Business Argument for a Just Cause Employment Standard, and one on cleveland.com, which was entitled More Coronavirus Work Protections Are Needed for Low-Wage Workers. So I'm going to jump right into our questions to the panelists tonight, and then we'll take your questions as they come in. So I'm going to start with Dr. Armitage. So Dr. Armitage, with the continuing spike of COVID-19 cases in Ohio and cases across the nation, what steps can individuals take to protect themselves from getting or spreading COVID-19 this holiday season as we want to join and be with family members? Dr. Armitage?
Yeah, thanks, Margaret. COVID is spread person to person. That's how it's spread. And the way to protect yourself is to avoid being indoors with unmasked people who are not in your core group. It's painful to say that large family gatherings at Thanksgiving should be avoided. You know, people that are not in your daily core group can have COVID, not know they have it. And the transmission is primarily indoors. So being unmasked indoors with people not in your core daily group that you live with and interact with, you know, every day, that's to be avoided, and that's how we can all avoid getting COVID.
Great. And in addition to that, of course, I'm going to ask this question to Dr. Harwell, that now that we're told that we can't even be with many of our family members who are outside of our circle. So this increases so many fears and anxiety that we've already had. So what can people do to cope with their feelings and stress during these holidays?
Well, first of all, like Dr. Armitage said, I think it's important that you know the facts, okay? Know the facts, know what you need to do to stay safe, to keep yourself safe and those that you love. And so this is some very trying times. And so we have to be a little more creative with some stress relieving things that we can do, but yet still stay safe. So, you know, listening to music, you know, outside, you know, still wearing your mask and, you know, going for a walk. Massage, you know, learn to, you know, give each other massages, you know, to release stress and tension. But with the holiday season coming up, I know it's very stressful for people. We want to be with our loved ones, but to decrease some of this stress and anxiety, we're going to have to be, creative in ways that we can sort of, calm things down. And, listening to music, taking walks, massages, if you like to exercise, singing, get a karaoke box, and karaoke. And, with social media like it is, and with these Zoom calls and FaceTiming and Skyping, there's still ways to see our loved ones and see our friends and families, yet remain safe.
Great, great. So, but even during these trying times, and we're talking about holiday season and spending time with some of our relatives and friends, there are a lot of folks who don't even have homes. There's a lot of folks who are facing eviction. So the CDC issued a nationwide ban on evictions after a surge of court cases were filed with courts across the country, especially in Northeast Ohio this past summer. So, Ms. Elder, can you explain this ban and how does this ban protect those who need this protection?
Yeah, thank you. So the Centers for Disease Control, I want to say back on September 4th of this year, came out with this eviction moratorium. Essentially what it is it places a temporary stop on certain evictions, that being evictions for non-payment of rent, until at least December 31st, 2020 of this year. So it stops those evictions until the end of the year. However, it's important to note that it's not automatic. So just because you're being evicted for non-payment doesn't mean it automatically applies. In order to trigger the application to a tenant would have to complete what's called a CDC declaration and provide that to their landlord. It is the filling out of that declaration and providing it to the landlord that does trigger its application. And again, it would stop the eviction until the end of the year. Now, there are certain requirements that must be met in order for it to apply. So you'd have to be evicted for non-payment of rent. You would have to say that you have applied for the rent assistance that is available to you. You would also have to show that you had some loss of household income, whether that be a layoff from a job or, someone in the household is no longer within the household. And although you may not be able to pay for rent now, you do have to also show or essentially say that you will continue to try to make rent payments as your circumstances permit. So this, again, does not mean that you don't have to pay rent. Even if it does stop the eviction, it means that, to the extent that your circumstances allow to at least try.
But Ms. Huntley, you are very aware of the fact that many of these evictions are caused because people are unemployed. People who have been religiously working and making sure they're taking care of their families can no longer do that. So tell us a little bit about what people should be expecting to go through once they present to the unemployment system.
Well, going into the unemployment system, I'm going to be honest, it's going to be tough and it's going to be slow. More people than ever are using the unemployment systems. So a process that would normally have, taken, maybe a month or two tops if you had to keep appealing, is going to take longer. There are individuals who appealed an unemployment decision in May of this year, and they're still waiting on a decision. So when you're approaching the unemployment choice, you have to find out whether you're eligible for just the regular state unemployment system or what's called pandemic unemployment assistance, commonly referred to as PUA by the governor or other individuals in the sector. And you'll have to go through a series of questions to decide whether or not you're eligible for either one. And if you have any questions on that, at the Legal Aid Society of Cleveland, we have a worker information line, which that number will be given, and we can help you decide if you're eligible for either.
And I'm sure that your office has been very busy during these last, 6 to 8 months now that we've been going through this. So I'm going to bounce back to Dr. Armitage. And so we think that we see there's help on the horizon, right? There's help that may be coming to us soon. And so Can you talk to us a little bit about the vaccine? We've heard about several of them over the last week or so, but can you tell us the status of when it'll be available? What's going on with the COVID vaccine? You're muted, Dr. Armitage.
I think from the very beginning of this pandemic, we thought vaccines would be the way to end it. And the hope for some miracle breakthrough treatment, was sort of a pie in the sky, but vaccines are a pretty concrete way. And the development around the world has been extraordinary. And all the early signals from the vaccine research in terms of safety and whether it produced an immune response was positive. And just this week, we've heard clinical trials. So clinical trial means you take a big group of people, half of them get the vaccine, half of them don't, and then you see who gets COVID and who doesn't. And 2 clinical trials from 2 vaccines, one from Pfizer, a big American pharmaceutical company, and Moderna, another company with a similar vaccine. 2 clinical trials have really shown excellent protection against getting COVID in the vaccine. So I think there's real cause for optimism that not only the early results showing a good immune response, but actual clinical results showing the vaccine prevents the illness. Incredibly exciting. Timeline is a little bit uncertain. I think it's realistic that our FDA will give emergency authorization to one or both of these first out of the gate vaccines within a few weeks. It's going to be limited as to how many people can get it. There's each company said they may be able to do 20 or 30 million individuals. The Pfizer vaccine requires a steep refrigeration. So I think in the first wave, which hopefully it'd be December, January, frontline healthcare workers, high-risk patients can get the vaccine. There's going to be a rollout protocol, which healthcare workers get it, which patients are identified as high risk get it. There's going to be more vaccines coming online, wider distribution of vaccines, but it's really exciting. It's very positive. It's all the more reason for people to hang on to that social distancing, hang on to that masking, because there is a real good light at the end of the tunnel.
So now, what's happening with many of the outpatient and inpatient treatments that we've been hearing about, and how are we diagnosing COVID-19 both as an outpatient and inpatient, and how are they being treated?
Great question, Margaret. So for inpatients, we have really 2 basic treatments now. This drug remdesivir, which is a drug that attacks the virus. It's not all that great in terms of slowing the virus. There's some benefit, but it's not a miracle drug. The big difference has been just a plain old steroid. Steroids are drugs that we take for a bunch of different medical conditions. And we've seen that in patients who are sick in the hospital, if we give them these steroids, it really does improve their survival. So that's been really helpful. For outpatients, there's really no great treatment right now. Now, one of the promising treatments are these antibodies. From the very beginning, we were given plasma. Plasma is blood from people who've recovered that has antibodies to attack and bind the virus. It works not that great. 2 companies have these monoclonal kind of high-tech antibody products that bind the virus. If you recall, President Trump got it from one company, Governor Christie got it from another company. One of the companies has received emergency authorization to give this product in outpatients. It's an injection or infusion. Right now, there's not that many doses. The distribution is still in question. So I think in the next few months, we may see this treatment in high-risk outpatients to give these antibody treatments. It hasn't been shown to be effective once someone's sick enough to be in a hospital. We still don't have any new treatments for that, but I think the antibody treatment could be very exciting once it's distributed and available, for the high-risk individuals we might predict would get sick, and if we can treat them early with the antibody products, we might be able to prevent people from coming in the hospital, ending up on a ventilator or dying.
That would be wonderful. Dr. Harwell, so, there's a lot of questions that are coming through about, trusting the vaccine. But first, let's talk a little bit about those who seek medical care, first of all. So, I'm having symptoms. Should I present to a medical care? And should I be afraid to present? And, how do I actually seek care when I'm so afraid of it? That's where we know most of the virus is, we think. But the real fact is that there's more outside than inside because people are asymptomatic. But is it safe to seek medical care for routine and chronic health problems at medical centers right now?
Absolutely. I mean, we're doing everything. We have all kinds of screening measures in place before you enter, all hospital systems, your temperature's being taken, you're being asked, these screening questions. And so, people should feel safe to come, both outpatient and inpatient. If you think you're having symptoms, you should contact your primary care physician and get some guidance, from him or her in terms of whether you need to be COVID tested or not, or, do you need to quarantine, or, exactly what needs to happen. But absolutely, I think both in the inpatient and outpatient facilities, it is absolutely safe to, still seek care. And so, the worst thing you want to do is, of course you're scared, but the worst thing to do is to wait around and, let symptoms, become worse, and, then find yourself in a position where, you're kind of fighting an uphill battle. So yes, it's scary out there, but I mean, I think going to some of these, bars and restaurants and some of these other social events is a little scarier because, you don't really know, where these other individuals have been and, what sort of precautions they've taken. But the healthcare facilities, absolutely safe places.
I just want you to address one more question before we go on into our great legal team is, we talk about this whole issue of trust. And so it's one thing to, okay, I'm going to trust and go in and get some treatment. And we know that many people are not. And across the country, people are dying at home because they don't trust the system. But now we have a vaccine coming out. It's coming out really, really soon. And there was all this discussion about how quickly they were moving forward to get the vaccine out. So, how do we convince people to trust that the vaccine is something that they should really think about taking? And is there enough data on side effects? And this is one of the questions that came from the chat.
Well, I think the fact that, it was called like sort of Operation Warp Speed, made people think that, we're just pushing something through, that we're not following, the scientific steps, to make sure that this vaccine is indeed safe for individuals. But there are so many steps and mechanisms in place for, vaccines and medicines to be, pushed through the FDA for final approval. So people should not feel that, corners were cut or, science wasn't followed, as these things were formulated. So, I think the fact that, there's a push to get, these vaccines out and to get these treatments out, it's making people think, are they safe, and, has this really been looked at thoroughly? And I think the answer to that is absolutely yes. I mean, there's always a potential for side effects from any vaccine. This vaccine is nothing different than, say, the flu vaccine that you get. There's always the potential for some, mild side effects. And I think people should keep that in mind and try to keep an open mind about that.
Okay, thank you. Ms. Huntley, lots of questions about rights, employees' rights and protections around COVID-19 pandemic. And so questions about what are the employees' rights and protections during the COVID-19 pandemic if they're working at an institution such as UH. And, they want to know how are they going to protect themselves in the legal space, if they're taking time off, if they're not, if they have to take care of their children. What are some of the things that can protect them as employees?
Yeah, so there are leaves, medical and protected leaves that were given to us at the beginning of the pandemic. Before the pandemic, there was something called the Family Medical Leave Act, which entitled workers to 12 weeks unpaid leave with, the asterisk that as long as their employer was covered. Well, at the beginning of the pandemic, there was an emergency FMLA, which is an Emergency Family Medical Leave Act under what's called the Families First Coronavirus Response Act. And through that act, we gained more paid leave and more unpaid leave that is protected, and that could be used to take care of your children if they go to work remote. It can be used to, take an hour off of work to go get a COVID test. There are all these protected leaves that weren't necessarily there before. And you also do have the right to a safe working environment no matter where you work. You have to make sure there's hand sanitizer, there's masks. The law doesn't require your employer to pay for those masks, but they have to follow the protocols and guidelines that were set out by the Occupational Safety and Health Administration, as well as the CDC.
Great. So tell us a little bit about the fact that people are discriminated against. We see that all the time. So what happens if someone thinks they're being discriminated against at work?
So if you think you're being discriminated against at work due to COVID, you may have some protections under the Families First Coronavirus Response Act. I would make sure you take note of every time you think someone's discriminating against you or retaliating against you for potentially having COVID or being an individual who might be considered high risk. And also, if you think you're being discriminated against for taking the leave to take care of family members or anything related to COVID, talk to your HR department, go through your internal processes at the job first. And if those don't help you, you can contact the Legal Aid Society. Like I said, we have a worker information line where we can help you figure out what's really going on and if there potentially is some unlawful actions there.
Great. So, this whole issue of unemployment benefits and lack of really then puts us back in this space where people cannot afford to pay the rent. They cannot keep up with their utilities. So, Ms. Elder, can you talk a little bit about, just living in the space where you can't keep up your rent, and does the landlord have to keep up the property even though you're not paying the landlord? And talk a little bit about, how are there resources to help people with this problem?
Yeah, so first and foremost, as all of us know, there are lots of people who are struggling to pay their rent, either because they lost their job, they had to leave the job because they now are taking care of children at home, for many reasons. I would say that first and foremost, communicate. Communicate with your landlord if you're having help or if you're having trouble paying your rent or paying it on time. Sometimes it's a matter of just saying, hey, I need a little extra time. Is that okay? I'll have it, on this date. I have seen that where landlords and tenants are likely to have a conversation that helps in the process a lot. Additionally, if you find yourself in a situation where you can't pay rent, there is lots of rent assistance help out there. There is rent assistance help through CHN or Cleveland Housing Partners. They have access to CARES Act money where they can help provide monies for the back rent that a tenant may owe. There's also help where there are subsidies that can help you pay rent going forward. If you're still in a situation where maybe finding a job has been really hard and you anticipate not being able to pay your rent going forward, there is help for that as well. There's also help through Eden, who is another rent assistance or housing stability organization that is out there. So you can contact these organizations directly, or you can contact the Legal Aid Society of Cleveland, and we can definitely put you in contact to having access to those resources or help you with the process.
And what about,
oh, go ahead.
Sorry, what about utilities? Because that's a big deal as well.
Yeah, so I do know that Cleveland or the CHN partners, they also have a utility assistance program that they can connect tenants with. But again, you do have to reach out to them and make it explicitly clear that you not only need help with rent, but you also need help with utilities as well. Now, I know that there are other utilities assistance programs out there. Off the top of my head, I'm not as familiar with those programs, but I know for sure that CHN does have assistance help out there.
So, tell me about IRA money. So it says one of the questions is IRA money protected from civil judgment in Ohio? Because that is a source of income. So either one.
Corinne, would you have more information about that?
I personally wouldn't. It's not within my practice of economic justice. But again, that's one of those situations in which you call Legal Aid Society. We try to either see if it's a situation that we can help you with, or like Anastasia said, we can connect you with resources.
Okay, great. So another question that came in, and I'm going to ask Dr. Armitage to take this question, and it is, what is UH's plan if Ohio goes into another lockdown due to COVID-19? And I think we're heading to that, another either modified lockdown based on what the governor said today. And if you can kind of address where do you think UH is going to be, what do you think UH is going to be doing at this
Yeah,
point?
I think, we have experience having done this in March and April. I think we'll do what the virus demands us in terms of our capacity. The first priority is always taking care of patients, and we'll follow the governor. And I think if we have to curtail some activities like elective surgeries, that'll probably be a policy across the state. I think we have a senior COVID leadership team. They're following the virus, the cases, we're preparing. And we did this in March and April. We have experience doing it. And, I'm always an optimist. I hope the rise will flatten the curve. But if we don't, we're prepared. We're prepared in terms of the making beds available and having nurses, doctors, respiratory therapists there to take care of the patients. So we did it in March and April. We have experience. We'll do it again if we have to. We'll follow the lead of the virus. We'll follow the lead of the governor.
Do you want to comment on the governor's conference today and what some of the things that he outlined?
Yeah, I think, one of the painful things of this pandemic is certain businesses and groups are hit harder than others, economically. And I think it's clear that bars and restaurants are a place where people gather indoors and the virus is spread. And the governor put this curfew in, I think, to limit maybe time in bars and restaurants. I think he's trying to tread this line between shutting down in a way that really hurts these businesses, but try to get people to act responsibly. So I think today the governor said, 10 p.m. to 5 a.m. curfew. I mean, you can go to work, you can go to the store to buy things, but I guess you shouldn't be out doing non-essential activities between 10 p.m. and 5 a.m. And it's really an attempt to limit the spread, to limit, limit people being indoors, unmasked. Outdoors is low risk. When everyone's masked, it's low risk. But indoor groupings, indoor gatherings, when people aren't wearing masks, is just a no-no now with all the spread we're seeing.
So on those lines as well, who would be the most high risk to get the vaccine when it's ready? Because we talk about those people who are essential workers, and when we say that, we usually refer to hospital workers. But there are a lot of people who are first line workers, people who make sure we get our groceries, people who are doing a lot of things out and around, and from a medical perspective, will they be at the front of the line for a vaccine as well? And also on the legal standpoint of it, there's many people who are working in these jobs that don't even give benefits. And so, how are we protecting them as well? So Dr. Armitage, can you answer that first part of it? And then I'll shoot back to our legal team and see if they can answer the second part of it. So who would be in the front of the line to get the vaccine?
Yeah, that's a great question, Margaret. I think these protocols are being worked on, and clearly, high-risk individuals or individuals who are older and have comorbid conditions such as obesity, diabetes, and hypertension, and people with obesity, diabetes, and hypertension who are frontline workers, whether they're healthcare workers or in other settings, I personally think should be in the front of the line. I think the protocol is going to be based, nationally and state-based to try to identify people. One of the questions in the chat is, hospitalized patients. The vaccine prevents the virus, so it's too late if you're in the hospital. But I agree with you completely, Margaret. I think, the bus driver, the cafeteria worker, the grocery store worker who have comorbid conditions, I think they should be up there in the front of the line with us healthcare workers.
Right. Is it any different on the legal front as far as protecting their jobs? They're working in these low-income jobs. They're, many times they don't even have health insurance or minimal health insurance. So, are they protected as well?
I mean, it's hard to say. I think inequities in job benefits and job protections is something that we in society have not been historically great at. Unfortunately, Ohio is currently an at-will state, which means you can be hired and fired for any reason. So, you know, even if it's not related to COVID, if you miss a shift or something, you can get fired very easily. And I think that we do need to provide more protections for these workers, not just health wise in terms of like providing masks or hand sanitizer, but we need to provide the protected leave, the leave that, you know, allows these workers to go get vaccinated, to get tested. And unfortunately, the Families First Coronavirus Response Act, which supplies that, ends at the end of the year. And we don't know if that's going to be expanded or to what degree it would be expanded.
So you're working in a low income position and you're worried about getting fired, but maybe you're tested and you're positive. So Ms. Elder, is it mandatory that they tell their landlords that they have been tested positive for COVID, or landlords requiring that they get tested? Where are they at with the rights of these employees who have to have a place to live?
Yeah, I think that's a good question. I'm hesitant to say it's mandatory. I would say, you know, if you know you have the virus, I would encourage any tenant to follow the guidelines as established, you know, by our governor, to quarantine and stay inside and seek medical help as necessary. I hesitate to say that you should be spewing your private medical information, or be forced to have to do that. Again, I would encourage them to, you know, quarantine and take the necessary precautions as required of anybody. But I would say it's not mandated. I'm hesitant to say that.
So what about the protection of medical records, Dr. Harwell? Can you talk a little bit about that, so to let people know where they stand as far as their medical records?
So absolutely, that your medical information is always and will always be kept private. I know university hospitals, you know, we abide by all HIPAA regulations, where, you know, the content of your charts, your office visits are always kept confidential. We've worked very hard with our employees to make sure that, you know, even walking in the hallways, in elevators, any place that, you know, you are outside of the physical space of an exam room, that individual's medical encounter and that person's medical records and medical information is absolutely 100% kept confidential.
Okay, so staying with you, Dr. Harwell, tell me a little bit about, there was a question in the Q&A about autoimmune diseases. Not one, if you can just reflect a little bit about the vulnerability of folks who have autoimmune diseases, and then the question specifically about, you know, how is someone who has the disease going to know what vaccine to choose, and, you know, how do they go about navigating that if in fact they need to get the vaccine?
So, you know, so autoimmune diseases are diseases such as lupus, rheumatoid arthritis, to name a few, where the body's cells sort of turn against themselves. And this leaves individuals' immune systems compromised, which makes them more vulnerable to catch diseases, to have worse outcomes, you know, if they just even catch, you know, the common cold. And so these immunocompromised individuals are, of course, I think in the category of being at an increased risk, especially, you know, when it comes to COVID, and may not having, you know, as good of an outcome or a not so rocky course with the disease. In terms of which vaccine, I might boot that to my colleague, Dr. Armitage. I'm not as well versed on how one would choose one vaccine over the other, but I would definitely say that, as Dr. Armitage mentioned, when it comes to rolling these vaccines out, figuring out who is at an increased risk, who should be getting these vaccines first. Of course, people with immunocompromised states, I feel definitely should and most likely will be at the top of that list.
And as you answer that question, Dr. Armitage, about the vaccines and who would choose, there's concern about safety as well as concern about discrimination. And so one of the questions is, who's going to make those decisions about who's offered the vaccine first, knowing that there's been so much discrimination around African American communities and where we are in this country as relates to taking care of our Black and brown brothers in our own healthcare systems. So who's making those decisions?
I think it's going to be panels that do include medical ethicists and in our diverse panels. I think that's critical. There's a history in our country of kidney transplants. Back in the 50s and 60s, there was committees, and they would decide based upon societal worth. I mean, what a charged term, crazy. And really, I think early on with the vaccines, it's like we're rationing healthcare. I get that. I do think there'll be, medical ethicists, diverse groups, including clinicians, and that's critical. In terms of the safety of the vaccine, we're living in a time in the United States, in our society and our culture, where, a segment of our leadership have called into, don't believe in truth or science. I think with these vaccine programs, the companies and the institutions have tried to be as transparent as possible, publishing their protocols. And I don't think anything will be hidden. Any safety issues will be hidden. It could not be more transparent. And probably between Moderna and Pfizer, 70, 80,000 people have got the vaccine so far. So it's getting a lot of data on safety. So I'm pretty enthusiastic. The other question I saw in the chat, I'll take, if I may, as Dr. Slaughter would say, our boss, Dr. Arlo, is, the question was, what vaccine should I get? The first one available. If you're in line to get Pfizer and Moderna, it's available, get it. Don't wait for one. We're going to have several available, and everyone should get the first that they can.
I agree. So there was a question about having to quarantine and who decides, when you have to quarantine as it relates to housing, if you're positive. I mean, and anyone can take this question because it's about, you're positive, and who's telling you and who's making the decision that this is something you have to do.
I'll just say one thing clinical, then I'll defer to the lawyers. But the good news about this virus is if you get it, you're really only contagious for 8 or 9 days. So after 10 days, you can consider yourself not contagious, 10 days from a positive test. So if you have it, you only need to isolate for 10 days to not give it to somebody else. Quarantine is when you're exposed, and people are supposed to quarantine 14 days. But I don't think there's any legal obligation right now. I'll defer to the legal minds.
Mm-hmm.
I mean, I would just say, the guidance that I think all of us have heard, whether it be from the governor or from the CDC, is that if you know that you have it, if you know that you have been exposed, or if you think that you have been exposed to it, that best practices is to quarantine. Again, what Dr. Armitage has said, I'm not sure there's this absolute mandate. No one's going to come to your door and blockade it and you won't be able to leave. But just, best practices have been, if you've been exposed and you care about yourself and others, to just take the necessary precautions and stay home.
So, which is what we all should be doing, is being responsible, trying to take care of one another. And that means that we all should be wearing masks and all of the things to protect us. Now, one of the other questions that came in for our legal team is that I was to start a job and then COVID hit. And so this person ended up at home because the daughter's school was closed. And now the children are now being educated virtually. So are there any programs that can help with money so that they know now that they have to stay at home because they're running out of money? They just don't have any employment because they can't work.
Yeah, so one of the benefits of this pandemic unemployment assistance was that it is for situations like that, where you just started a job, it got rid of those requirements that regular unemployment had, where you needed to work at a job for a specific amount of time and make a specific amount of money. You can collect PUA if your child's school is closed. And that can also include situations in which your child goes to school for a few days a week, but is also remote learning several days a week. On the days your child is home remote learning, if you have to take off of work to be home with them, you are potentially eligible for partial unemployment under the pandemic unemployment assistance.
And if I might add to that, as far as, that affecting your rent, these rent assistance programs do take into consideration those COVID-related hardships. So for example, CHN, when you complete an application through them, they want to know whether it was COVID-related, whether that means a direct layoff or because you just couldn't continue to work because you didn't have anyone to babysit and take care of your children. And so, in addition to what Corinne has stated, there is that rent assistance money that does take into consideration any hardship that would be COVID related.
And so what happens to the young men and women who end up evicted and are in some of our safety nets, some of our homeless shelters? Do you all continue to work with them in order to try to secure housing during this state?
So if they had previously contacted legal aid and unfortunately had an eviction judgment put against them and we're still working with them, we can, direct them to other resources such as coordinated intake and other programs in the city of Cleveland that will, assist in housing stability. We also have an internal, social work referral where if we're working with certain clients who have, additional social needs outside of just the purely legal issues, we can also assist with that as well. And then you also have, your resources such as 211 that can be reached anywhere that can also help assist with those issues that, again, are not purely legal, such as, homelessness and other things.
Mm-hmm. Another question on that line is the people who quote work off the books that and they're having a difficult time, like they're cleaning houses and they're doing things that are just trying to make ends meet. Is there any relief for them at all as far as transportation or anything like that that's available as a resource that you would know about or would even be available?
So again, like Anastasia said, if you call legal aid and you're dealing with one of these legal issues and you present with some of the other issues you're describing, we'll do our best to connect you with resources. I will say if you are working off the books, there are potential for wage violations, which is something that we also handle at legal aid. We're finding that, employers or people are taking advantage of this time because, like you said, people are taking odd jobs to make ends meet. So if you think you're not getting paid right or you're not being protected in this job that's kind of under the table, you still call legal aid. Make sure you document everything. And the same goes for like any, violations of safety at work or asking for these protected leaves. Make sure you do it all in writing if you can.
Right. And so another question on the lines of benefits, short-term disability. Does short-term disability also cover COVID-19 illnesses and exposures?
So short-term disability is largely much like how unemployment originally was. It's, it's based in a lot of what the employer is willing to pay, what they pay into. And for short-term disability, I haven't seen any specific legislation personally about COVID-19 specifically falling under a short-term disability. But since it wouldn't fall under a disability, it's something that if you're questioning whether or not you're owed it, just call legal aid. We'll try and connect you with the right resources.
Okay, great. So back to Dr. Armitage or Dr. Harwell. One question is, can you get COVID-19 twice? And the other question leading up to that as well is the question around getting COVID and being ordered to stay in quarantine. So there was in the chat box, it says there are local ordinances that can order a person to isolate or quarantine because of a contagious disease. Now, we know that this is reported. So they are reported to the public health department if you are diagnosed. And we do contact tracing. So it says that local public health offices currently issue these orders, and there are consequences if the order is not followed. Now, we don't live in China. We don't live in places where they put, where they're actually tracking you and they put tracers on you. And so this is a very different and difficult challenge. So one, can you get COVID-19 twice? And then two, what about this whole local ordinances? Do we know anything about those?
I can hop on the first question and then I'll defer to the second question. Yeah, there's been, 40 million or more people around the world who had COVID. The number of documented cases of getting it twice are really small. So I don't think we know the significance of whether you can get it twice. There's clearly some documented cases. In all but one really rare case, all the second cases, these few second cases were mild. So I'm pretty confident that if you get it once, you're not going to get it again and end up in the hospital. And I think getting it a second time, at least in a few months or hopefully a year or so, will be really rare. But we just don't know. We're still accumulating data. With the vaccines, along those lines, we may have to give vaccine boosters, to keep the immunity high to prevent people from getting it.
Did someone else want to take that other question? What about this forced ordinances?
I'm not an expert on the legal issues. I think that our approach nationally and in the States has not been to force people. There are illnesses like tuberculosis and syphilis where there is contact tracing, and public health authorities have the right to contact people and the right to try to contain these infections. In this country, we have not applied that in a broad way to COVID. Mm-hmm. And I think there are some countries who've been very successful in controlling it by a lot of testing, a lot of isolating, a lot of contact tracing. It was really kind of widespread here by the time we could do that. And for sure now, it's just way too widespread to take that approach. To find people, contacts to contacts, isolate them. The cat's out of the bag for doing that.
Mm-hmm.
Yeah, I would have to echo what Dr. Armitage has said. And, as a lawyer, I think a lot of us just, default to if it's an order, we follow it. But again, there's no one there forcing you to do anything. It's really about best practices on how to best protect the community as a whole. I'm unaware of any cases where there have been, criminal charges attached to, not staying indoors per an order or civil penalties even. But again, I think that the community should, just take the necessary precautions to protect each other, whether there are civil or criminal penalties attached to it. We know that this pandemic is serious and that COVID-19 should be taken seriously. And, if we're all in this together, maybe the quicker, it goes away or is controlled.
So we have a couple more questions, and then I want the panelists to give their last words. But one question is, if your school goes hybrid, but you don't feel comfortable returning to classroom, what rights do you have?
I mentioned earlier, if your child is going back in a hybrid situation, you could be protected under either the Families First Coronavirus Response for that leave for those days, or unemployment through the Pandemic Unemployment Assistance Program. You can potentially claim partial unemployment for those days, but both of those programs are only available to the end of the year. And right now we don't know what comes next, but at the Legal Aid Society of Cleveland, we'll keep you updated. As soon as those laws or ordinances come through, if they do, we will keep you informed.
And this follow-up question, my employer is saying that he is exempt from the FFCRA because there are only a few employees. do I have any recourse?
So certain individual employers can be exempt from the Families First Coronavirus Response Act. But your employer also does have to tell you if they are a part of the Families First. They have to have it posted just like you would the OSHA guidelines. If you are unsure of whether or not your employer is covered, or you think they are not being truthful about their status, call our worker information line. We'll see if there's anything we can do or any resources we could direct you to.
Great, great. So we are quickly running out of time. This has been a great discussion. I want to leave the last few minutes to have the final comments from all our panelists. And we'll start with Dr. Harwell.
Well, so I also sneaked and looked in the Q&A box as well. And someone asked, will there be education about how to wear a mask? So my final thoughts here, my final comments are, thanks, Dr. Armitage, you got it. You want to make sure you're covering your nose and you're covering your mouth. So it's not to be worn under the chin. You know, it's not to just only be worn across the mouth. It's the nose and the mouth. So we need to mask up, we need to social distance, and let's try to stay safe.
Great. Dr. Armitage?
I've worked with Dr. Harwell for 25 years. She's a wise woman, so I back up everything Carla said. There was a comment in the chat about trusting the vaccine. I just a personal anecdote. Myself and my family all volunteered for the Pfizer trial because we think it's important and I think it's safe. And I hope that speaks for itself. I've seen what COVID can do. I work in a hospital. I think the risk of the vaccine, if there is a risk, is exceptionally low. The risk of COVID to ourselves and our loved ones is really high. I hope people support the vaccine and keep masking.
Great. Miss Elder.
Yeah, so first, thanks for having me. If I had a few extra words to add here, I would speak to advocating for yourself in court. So as a member of the Right to Counsel team at Legal Aid Society of Cleveland, I would encourage tenants, if you're a tenant within the city of Cleveland and you have at least one child in the home, whether they're yours or not, and you think you may fall within a certain percentage of the federal poverty guidelines or, low income, then you possibly qualify for a right to counsel in court. And so if a formal eviction has already been filed against you and you're in court, speak up and mention that, and likely someone will be in contact with you about having counsel, particularly through the Legal Aid Society of Cleveland. And then secondly, I know there was a question earlier about whether your landlord has to make certain repairs in the home during this COVID-19 period. And I would say yes, but be reasonable. There's a pandemic going on. Outside of the pandemic, a landlord usually is permitted to fix something within a reasonable time. And now reasonableness, those lines have been blurred a little bit. So, if it's a little bit longer than it normally would be, perhaps offer some grace. But all in all, repairs still need to be done. And if it's an emergency situation, then I would encourage you to contact the Legal Aid Society of Cleveland, and we can help you navigate the process needed to get those repairs done.
Thank you. Ms. Huntley, you have the last word.
I want to take the time to acknowledge that we at the Legal Aid Society of Cleveland see you in all of the struggles you're going through right now. When it comes to either housing or employment, we understand that you feel unstable. We understand that the Black community is more likely to be essential workers, and that, these systems that you're going through, whether it's collecting leave or collecting unemployment, they seem inefficient and slow, and that's because they are. And I think we need to acknowledge that those systems, even though they're inefficient to everyone, inefficiency disproportionately affects certain groups. And so I want to acknowledge that. And if you feel like you are not getting through the system the way you need to, please call us. We will do our best to help you or connect you with the resources that you can, but your frustrations with unemployment or your lack of protections are completely valid.
So I'd like to thank our Cracker Jack panelists and make sure you look at your screen. We have information to make sure that you have further contact information. But this has been a great, robust discussion, and we hope that we've helped you. We know that you have helped us, so we know in some directions where we need to actually put more focus. Again, I want to thank my team from University Hospitals, Kelly Crow, of course, who's always done these so very well. And with that, I'm going to wish everyone a wonderful evening. Thank you very much. Take care now.